vaccine get an adjuvant called aluminum. They're getting aluminum injected into them, which is the adjuvant in the vaccine. It's not a control study. And aluminum is a neurotoxin, which I'm going to cover. My point is, none of it's scientific. So they are ethically violating their own ethics because they're injecting children with aluminum as the control group. Just shows you the deception taking place.
That's right.
In 1931, the World Health Organization reported that we were second nations out of 81 in overall health. Japan was ahead of us. Number 2 in 31. Can you imagine that? By 1999, we've dropped down to 79th out of 81 nations. 79th. More babies die the first year of life in the US than in every 33 other nations. Which, think about that. We have more doctors, more nurses. We can have babies that are born at 28 and 32 weeks, and we save them, we keep them alive. We have more neonatal care units. We have clean water compared to third world countries. We have the conveniences that third world countries don't have. We have food. Even our poorest in this country get food every day. One way or another, they get food. Why are our children dying at such a high rate? And that's why I really started digging into this. It's called follow the money. A patient cured is a customer lost. You know, when I was raising my 5 children with my husband, and we were taking care of their health care, we did not have one of those plastic little cards they call health insurance. To me, that's just assuring you're going to need the drugs. We actually funded our own medical needs if we had. We had a couple, broken bones in the hospital, and a couple stitches, we were done. We paid out of pocket. Can you imagine the money 7 people saved, all those 25 years of being together, where we didn't pay a dime in medical insurance? And they didn't make any money off of us unless it was crisis care, emergency care. That's really what's going on. We didn't give them a dime. And they don't want people like me teaching you how to do the same. So, we must be willing to see what's going on, even if it's uncomfortable. I tell people all the time, you might not like what I'm telling you today, and I'm not trying to make you feel bad if you're vaccinated or if you're a nurse or doctor. But honestly, we have to be willing to see what we're doing. The number 1 assault, up to 100 vaccines is recommended through young adulthood, 38 to 40 by the age of 18 months, before they're walking and talking like a toddler would. Never before done in history. 100% experimental. And
Can you flip that back?
I sure can. And I'll send you, if you guys want a PDF of this whole lecture, I make it available to you, and it's 6 colored slides on a page. Because I want you to be able to share and talk to other people and get this information out. We have to wake them up. So, I love that. It says, please don't poison me. And parents, we all love our babies. We all love our children. Moms and dads, before they have their babies and they get ready for their baby shower, they research what stroller they want. They research what car seat is the best. They research all the stuff that they're going to do with their baby, but they don't question when the doctor comes up with a big needle and wants to inject them. They don't question. This is why you need to wake them up. And aborted fetal tissue, they've been using aborted fetal babies for many, many, many decades, okay? This is a picture. It's an awful picture. I actually have videos that I don't like to share. I have at conferences, videos of them in a big, huge wash tub. Like if you put 2 tables together side by side, they have all these, they're washing all of the just aborted babies to ship them off to make drugs and cosmetics. It's criminal. The devil is getting his way right now. But we're going to stop it, right? Today, more than 23 vaccines are contaminated by the use of aborted fetal cells. There's no law that requires that consumers be informed that some vaccines are made using aborted fetal cells and contain residual aborted fetal DNA. They do not identify the cells as being derived from electively aborted human fetuses. And they're called human diploid tissues. And this is from lifesitenews.com. They've done lots of studies on this. Children, by the way, the most valuable baby is a baby that's aborted at 5 months when it's alive and can live outside of the mother. So they purposely abort babies older, 5, 6 months along. They don't mind the older ones that come in because they keep those babies alive, and the reason they keep them alive is because stem cells will die if they aren't getting oxygenated, and the tissue in the body will begin to deteriorate. They keep the babies alive as long as they can and ship them out alive so that their stem cells can be taken from them. And by the way, they use no antiseptic or anything, no anesthesia when they abort, when they take these babies. They can't contaminate the cells. This is child sacrifice.
Yeah, that's right.
This is showing you the list of vaccines that kids get. The pink is on aborted fetal cell tissue. Like I said, I have all this I can send to anybody that wants it. Make sure you get my card on the way out, and you can call me and let me know. There was a study done in Italy called the Corvella study on GlaxoSmithKline's trivalent measles, mumps, and rubella, and chickenpox vaccine. 4-in-1 vaccines in one jab, okay? And what they did is they found out that that vaccine has the presence of fetal DNA from the cell lines called MCR5 and VBI38. And basically, it's 100% male DNA in that vaccination. 100% male DNA. How does that affect the little baby girl?
That's right.
I mean, my gosh. We wonder why we have gender confusion issues in this country?
That's right.
I believe it's one of the main causes. Yeah, they found complete individual genome of a little male boy. So, by 2023, age 1 to 4 years, death rate has increased. By the way, I'm going to talk now about how in this country, when we have babies die of SIDS, sudden unexplained death, or fetal demise, we do not do the proper autopsies to determine their death. In 2023, according to the CDC, approximately 400 children in the United States died suddenly and inexplicably after their first birthday. Usually babies die of SIDS when they're like 2, 3, 4, 5, 6 months of age, because it's usually respiratory failure. But now they started to see a phenomenon of kids dying after the age of 1. The majority of these unexplained deaths in children aged 1 to 18 years affected those aged 1 to 4, which is when they're getting a really, really heavy dose of vaccines. Slightly more males, 60% were affected. Unexplained death among children aged 1 to 4 years was the 4th leading category of death for this age group in 2022. The problem, vaccines are tested on already vaccinated individuals that statistically already may suffer with chronic health problems and are considered normal and then compared to other vaccinated children. They do not do double-blind placebo studies. Never have, not one, on any of the childhood vaccines. So this is the problem. It's not science. When they say all the science has been done, they're either ignorant, or they're lying, or they're covering up the truth. The science has not been done. They do not perform double-blind placebo safety studies. If you can hold questions till the end, that would be great. And this just shows you, in 1986, this is what a child in the mid-80s got. They started adding them after that wonderful Liability Act, and now look at the list of what they get. Unreal. I'm going to present this. If you got a rattlesnake bite in your leg, let's say a poisonous rattlesnake, how long do you think the venom, how long do you think it would take it to get around your body? 24 hours, somebody said? Guess, anybody, any nurses? How long do you think? 10 minutes, 20 minutes. In fact, what do people do? They try to suck it out, right? They try to suck it out if they're not by a medical facility. And then what happens to that venom? It gets all around the body, right? What if they don't get the antidote for that venom? What if they don't get that? What happens to the person? They die. Organs fail, they start having problems, and they die. Well, guess what? Doctors have never, ever once studied the systemic effects of vaccines. So vaccines, when a child gets it, it's a deep injection, okay? And they have never thought about how long it takes for whatever's in that vaccine to get around all the parts of the body. Which to me is like unbelievable that they have never studied the systemic effects. And again, how long does it take to get into the bloodstream? my research shows that the bloodstream, some of the vessels are very permeable, and it can get in very quickly. So we could say that within 24 hours, whatever that was in that vial, whatever they got that vaccine, which could be up to 6 shots in one vial, is now circulated around the whole body, and no one's ever studied what happens there. In May 15, 2024, Dr. Lasserson, who's the head of the CDC's global work, okay, she admitted that they were very concerned because they do not have the necessary safety studies to support the vaccines. And her concern was the anti-vaccine movement was growing by 500% faster in recent years. I think we should applaud that, right? Right? I was like, yes! She admitted they do not have the science to support the vaccines. You know what's happening? Doctors are going, wait a minute, our patients are coming in and they're telling us they don't want them. They're worried about side effects. So the CDC and the World Health Organization are having these conferences to discuss this. And basically, they admit, we don't have the science to support it. She went on to say that doctors and nurses in med schools are lucky if you get a half a day of education on vaccines. Safety is the biggest issue, fear of side effects, the #1 confidence problem is safety. And so they were trying to figure out how do we get these people to comply? What tricks, what training do we have to give our nurses and our staff to get them to comply? Dr. Martin Koldorf, PhD, he is now the Advisory Committee on Immunization Practices. He's the new co-chair. Okay, this is good news. He said this just last week. In addition to studying and evaluating individual vaccines, it is important to evaluate the cumulative effect of the recommended vaccine schedule. This includes interreaction effects between different vaccines, the total number of vaccines, cumulative amounts of vaccine ingredients, and relative timing of different vaccines. Do you know, I was like almost in tears when I heard this. Praise God. We have somebody who's going to ask the questions, who's going to look. And this is why they're getting so much heat right now. Because AMA, they don't want this coming out. I was so excited to hear this. This has been my prayer for so many years. A new committee, working group, will look into these issues, said Koldorf. The Center for Disease Control and Prevention currently recommends at least 70 doses of 15 different vaccines for our children and adolescents up to 18 years. So they know we have a problem, a serious problem. The World Health Organization in 2019, the head, Dr. Larson, discussed the lack of science supporting the safety of vaccines, and they admitted that they only study the local adverse events and do not study systemic issues following vaccines. Unbelievable. They admitted. So while I was writing my book, okay, so over the years, parents would say, well, Mary, if I don't vaccinate, what do I do, you know, and what do I do with issues? And I don't give them medical advice. I share my holistic philosophy with them, and I share them ideas of what they can do. And I give them, I lead them to websites and direct them into different books. But I wrote a book called Natural New Development and Deeper Understanding, because the first thing you have to do is you have to understand that #1, God did not make a mistake when He made us.
That's right.
You know, He made the animals, and they all live in the wild, and God said, this is good. And then He made man in His image.
Yeah.
And He said, this is good. Do you think He forgot to give us an innate wisdom, immune system inside of us that knows how to survive? But try to tell that to your pediatrician doctor, because they have absolutely zero confidence in the human body, because they don't understand it. They haven't studied immunity. And because I've studied immunity under 2 different immunologists, I have an understanding of how this works. So while I was writing my book, imagine this. There was a new organ discovered in the human body in 2018. A new organ. You know, we think they're so smart. We think they're so bright. They do everything, right? They're the white coats. They're the ones that wear the stethoscope around their neck, right? When I heard this, it made everything in my whole existence fall into place. I used to say, how does a child get a vaccine here and it gets in the brain? How does they get here and it ends up causing diabetes, or liver failure, or liver cancer, or asthma, or Crohn's, and I could never figure it out. And I was asking God, show me how this happens. Because it wasn't in medical literature, and then they came out with this It's called the fluid highway system of the body. It is the largest system in the body. It's connected to every tissue, cell, organ, ligament, tendon. It completely controls the brain. So we have a fluid highway system that anything you inject into your body, or even put on your skin, gets absorbed in there and gets circulated on the whole body. And I went, oh my gosh, that's why we have all these different problems with children who are getting vaccinated. It depends on where they got injected and how it gets around their body. And by the way, you cannot compare eating with injecting. Because they say, oh, well, you know, mother's milk has aluminum in it. We get exposed to aluminum. You know, there's aluminum in the air, thanks to the chemtrails especially. But there's aluminum in the air. They're telling us all the time, aluminum is not an issue. Really? Well, what about when we inject it? How is it different? And that's where my deep dive got even deeper. The gastrointestinal system, by the way, is designed to chelate, pull out metals and things that harm us.
Right.
And it gets rid of them through the kidneys and the liver and our excretion. But when you inject, you bypass that. You bypass that whole system. And so your body is caught off guard. And in my normal vaccine presentation, I talk a lot about peanut allergies. Because you'll get this. I grew up in a big family. Peanut butter and jelly was a staple in our home. Probably 3 to 4 days a week we went to school with peanut butter and jelly. And all of a sudden, children are having severe anaphylactic reactions to peanuts. And people are like, why? Well, I'll tell you why. Because they started using adjuvant 65, which is the derivative of peanut oil, because it makes the body angry. It draws attention to it. That's what adjuvants do. They irritate, they antagonize, they cause a hyper-turbo immune reaction. Adjuvant 65 is made from peanut oil. When you inject it in the arm, the body goes, what the heck is that doing there? If you eat it, it knows it's food. It knows how to handle it. It breaks it down, you assimilate, you digest, you excrete, whatever. But when it's injected in the arm, it doesn't belong there. The body attacks it, and it develops immunity against it. It's fighting it, fighter cells. And every time they go in, every 2-3 months, they get a new vaccine, by the time they're 1 and a half, and they have their first little taste of peanut butter, they have a severe reaction. It could be a rash all over the body. It could be asthma attack. It could be all kinds of swelling up, whatever. But when they go to the doctor never stops to think it could be a vaccine. It's like, oh, your baby's allergic to peanuts. Don't give it anymore. And it just goes on from there. So this is why we have so many food allergies. They put wheat products in. We have kids that can't eat wheat. We have dairy products in. They have cow serum, cow pus. They have chicken products.